everybody. I want to make a quick video. First off, congratulations on successfully completing week 6. You guys are like right around the corner from completing this mod, and it's so amazing how quickly this mod has gone by. I wanted to make a quick video regarding this week's discussion. We're talking about the table of drugs and chemicals. There are going to be lots of times when your patients are going to have adverse effects to medications that are administered in the medical practice, and other times when your patients are going to come in because either they've been poisoned by some type of chemical, like household chemical, or maybe someone has tried to poison someone. So then that's going to be like poisoning by way of assault. Um, but whatever the case may be, this week's discussion is going to teach you about the importance of thoroughly reviewing the medical record. Because if you are reading a record and it states that the patient has a certain medical condition due to an adverse effect of a drug that the patient has taken, then that's going to need to be coded. And a lot of times it's not going to say due to an adverse effect. It may say the patient has a certain condition because they ingested too many birth control pills, or because little Timmy accidentally got into the medicine cabinet and thought the Tylenols were candies of some sort. Um, yeah, so these are going to be those issues in which you'll need to use the table of drugs and chemicals. Now, there is a difference between the total number of codes that are needed for ICD-9 as opposed to ICD-10. In ICD-9, if the patient has an adverse effect, you're going to need a minimum of 2 codes. You'll need, um, actually, I think it's going to be a minimum of 3, because you'll need the effect that the drug has had on the patient, as well as the drug itself, and then how the patient was poisoned, or not poisoned, but how the patient was affected by the drug. With poisonings, you'll also need a minimum of 3. You'll need the poison code, you'll need what happened to the patient, as well as, nope, stop, I gave that to you backwards. Let's backtrack. With adverse effects, you'll need a minimum of 2 codes. I always get it confused sometimes, but whenever you talk things out, then you can, when you hear it, then you can catch whenever it is that you've made a mistake. But with adverse effects, you'll need 2 codes. So you'll need the effect that the drug had on the patient, and then, like for instance, let's say that you've been prescribed a topical treatment for eczema, okay? And this topical treatment has caused a bigger rash than what you would normally have with eczema. Maybe it's blistering or something like that. So you would need to code the blistering, and then you would need to code the E code for that topical um, cream that was prescribed. And it would, of course, be for therapeutic use. But let's say that a patient came in because they are in a coma, they are completely unresponsive, they're in a coma, and it's because they ingested lye. That's a chemical. So you would need to code the coma. Well, actually, you'll need to code the poison code first if you're in ICD-9, then the coma, and then you'll need to code the external cause as far as like how this happened, if that is um, listed within that medical documentation. With ICD-10, if I'm not mistaken, the poison code will be eliminated because it's already bundled into like the external cause code. And you'll see that whenever, if you do have an ICD-10 coding manual, you'll see that it'll have in the columns poison by therapeutic use, or poison by assault, or something like that. So this week, I'm looking forward to interacting with you all as normal in the discussion forum. I hope that you all enjoyed the rest of your week, and that you get out to a great start, and we'll talk. Good night, everybody.